My parents would never have thought I'd get an opportunity to deliver something at the Royal Irish Academy, so that's a good start for me. And I want to thank the Minister for her words and for being here to support us. Thank you all for coming to the dual launch we have today. We've called the strategic plan Supporting Change, and the title and the content are a response to the modern environment in which we carry out our functions. This includes the changes in the remit of the Mental Health Commission as delineated in the Assisted Decision-Making Act of 2015 and as proposed for the forthcoming revised Mental Health Act, as the Minister has alluded to there. There are also challenging times for service provision, both for those who are administering the services and especially for those who are delivering them. And it's important that all concerned work together to facilitate and promote change to meet the needs of vulnerable fellow citizens of this country. The title is to give the sense of how, as a board, we see the Commission's future role as a supportive one, working with other people in the sector to ensure that vulnerable people are getting the support that they need in a timely and measured fashion. To support vulnerable people, we also need to support changes in service provision, and especially ensuring that those on the front line working with vulnerable people work in the environments and with the supports they need to do their job well. We have set out 5 strategic strategies in the next 5 years, but I want to first thank again the Minister for her support for the Mental Health Commission during her time in office and for her presence here today, which is, I think, a manifestation of that support. The Commission look forward to working with the Minister and her officials as we all seek to continue to support the continued evolution of mental health services in Ireland over the next 5 years. The strategy presented today is the result of almost a year's work by members of the board of the Commission and members of the executive. Our membership is taken from many sectors of Irish life and a lot of stakeholders, including service users and service providers, frontline clinicians. Development of the strategy also involved consultation with the broader community, including service users and frontline clinicians. The resultant strategy lays out a course for the next 5 years, which will build on the previous work of our predecessors in previous Commission boards and congruent with our vision, which is equity of access to person-centred mental health services and decision support services that deliver high-quality care and support. In developing the strategy, the board reviewed our mission and agreed that this is the promotion and vindication of human rights in relation to mental health services and decision support services. It's amazing how long it takes to get a short sentence developed and the amount of time around a table it takes, but that's what sums up what we feel we should be doing and what our vision is. Those of you who are still awake may have noticed that some of my paper stuck together and I actually skipped a page and went back to it. So just to go to the 5 strategic priorities for the next 5 years. Firstly, to continue to be a leading voice in relation to mental health services and assisted decision making. Secondly, to have effective and accessible communication and engagement, emphasising and promoting the voice of the person. That word person is another political agreement. We're all looking for terms to use for the people we work with, but we're talking about the voice of people who use the services. And too long, as probably it's not that obvious this morning, but I'm quite old and I've been a psychiatrist for many years. When I started out as a psychiatrist, patients were seen and not heard. That's changed a lot. Probably hasn't changed and come to an equilibrium as it should, but there's been a lot of move and we want to help promote that. Thirdly, to continue to drive standards, improve quality and safeguard persons in relation to mental health services that are regulated by the Mental Health Commission. And obviously, none of us want to go back to the old days of asylum, but if you think of the term asylum, it was about safety for people and looking after them. It unfortunately changed into something that wasn't so supportive. But we should at first make sure that we're looking after people and keeping them well and being kind. Fourthly, to promote and support assisted decision-making in society by embedding the decision support service as a respected public service. And the main key issue here is that every citizen has a right to take part in decisions made about them and has a right to exercise that to their fullest ability. And we should be ensuring that we make sure that we know what a person's ability is before we start to make decisions for them. Once again, At my age, I've gone through many years of seeing people being accepted as not being able to make decisions when actually they were probably better able to make decisions than I was at times, and this is something that cannot happen again. Our fifth priority is to be an effective, cohesive, transparently governed and agile organisation acting in the public interest, and we can only demonstrate that by acting that way through time. Our strategic priorities have been very much guided both by the increase in responsibility and the remit given to the Mental Health Commission already referred to, and for the need of an evolution in regulation to a supportive and collaborative one, especially as regards those in need of mental health and decision support services. I think for too long, regulation could be seen as what the Americans called a whack-a-mole approach. Those of you who've been to an American fun fair will know whack-a-mole is where you get a hammer and a mole sticks its head up, and if you hit the head before it goes down again, you win a prize. And I think regulation can be seen in that way and can be used in that way, but it's not helpful for anyone, and we're well aware of that. So I will talk about mental health and decision support services briefly and separately. I know all here today share a vision of this country having the best possible services for people with mental illness, both as regards dealing with illness and helping people maintain their mental health once they have recovered. It was interesting to hear the Minister refer to what people say about the Commission and what people say about HICWA, and we all know what people say about the HSE and what people say about the Department of Health. But those of us who work with people know that we all have a common goal, and people are doing their best to improve things in difficult circumstances. In the next 5 years, the Commission will be focusing on ensuring that mental health services are equipped to support people who have suffered challenges to their mental health, to acquire and maintain good mental health. The services that people avail of must be in the community and uniformly available across the country, and that's a problem. I think the Minister probably alluded to that from her experience as a public representative. It can be very geographically orientated where you are, and we're all working to change that. The Mental Health Commission is determined, with help from all stakeholders, to facilitate this evolution. Our aim is to work with service providers in a formative fashion, but continue to keep the needs of service users as our lodestone. This may at times lead to confrontation, but our preferred method of working will be a cooperative one. In carrying out our work, our key stakeholders will continue to be the individuals who use mental health services. The involvement of service users at all levels in the mental health system as regards contributing to policy and planning in a meaningful way has always been and continues to be a priority for the Commission. As well as having service users amongst our board membership, the Commission demonstrates a practical commitment to service users' views in the formation of our reports, discussion papers, consultation and reviews. We also consistently seek the views of service users in other ways. Our inspection teams speak to service users during each inspection of approved centres, and the board regularly invites presentations from stakeholders groups so that we as a board can hear directly about the reality of the lived experience of people who use the mental health services in this country. Service user involvement is a key theme in this strategy, as it is in the country's current mental health policy, Sharing the Vision. Developing the strategy, we were very conscious of our need to align with national policy in a critical but formative way. This strategy reiterates the Commission's long-held belief in person-centred support, empowering individuals and their supporters to be co-creators in their care, recovery and decision-making. And that word recovery is one of the key ones which the Minister alluded to too. We need to give people hope, and no matter how severe the illness, we know that people can recover and can live a life they find meaningful. I'm happy to announce that in partnership with the Department of Health and the HSE, the National Patient Experience Programme will include mental health for the first time and is strongly aligned with our strategic intent. And it'll be very interesting to see what that brings up. And we're the first country, as far as I know, to include mental health in that type of survey, which is, once again, Ireland showing a path forward, which is nice. Another group of people who are key to our work are those providing frontline services for people with mental health problems. It is vitally important that frontline staff work in environments that facilitate them using their talents and training to the benefit of the people they serve who have mental health problems. It is vital that they also work in teams that have the range of skills needed to deliver a modern mental health service. In our current work and in any expansion of our remit, such key issues will be promoted and supported. I want to speak briefly about the planned extension of the remit of the Commission to community mental health services. Modern mental health services should be primarily delivered in the community. Ireland has been a trailblazer in policy in this regard and is now catching up as regards resource provision. It has been the major lacuna in the regulatory situation that the regulator of mental health services has not had any role in working with community mental health services to ensure high standards evolve and are maintained. We must deliver support at the place where it is needed by the individual. It must be delivered by multidisciplinary teams in an integrated way. Ireland's national policy is clear on this, and the regulatory strategy of the Mental Health Commission will support this. I look forward to the delivery of the revised Mental Health Act and the challenges this will present for the Mental Health Commission to ensure the standards are developed which will facilitate the provision of modern community mental health services across the country. The revised National Quality Framework is a first step in this process while this strategy sets out our key objectives. So the framework is a tool that should be useful to everyone who is working in the services, but I also would see it as a resource for members of the public who are able to see what they should be getting when they or a relative needs mental health supports. I'm grateful that Minister Butler has come to support us today and to have the chance to officially assure her that we have developed our strategy to help the rollout of sharing the vision, and that we look forward to working with her department and other organs of the state to strengthen the standards, quality and regulatory infrastructure which protect human rights and continually improve service quality. It is now over 7 years since the Assisted Decision-Making Capacity Act of 2015 extended the remit of the Mental Health Commission to include the establishment of a decision support service. It's wonderful to know that we're now only a week away from the initiation of the service that has resulted. For too long, supports for people who may have problems with decision-making have been old-fashioned, paternalistic and of a blunderbuss type. For many years, support has been available to vulnerable adults through the wards of court services. But it is over 20 years now since myself and colleagues met with the then President of the High Court, Justice Costello, to discuss concerns he had about the effectiveness of the system for people with a variety of vulnerabilities. The Assisted Decision-Making Act will allow a much more nuanced approach to the support needs of people with varying degrees of cognitive challenges. Through the Decision Support Service, support is available to all who may have queries about their own capacity or that of a loved one. It will also be possible to support people with concerns about mild cognitive issues that may be affecting them without taking away their independence or rights on a wholesale basis, as is the only option at present. It is also possible now for people to plan ahead for a time when they may lose capacity, meaning that this Act and the Decision Support Service are resources for everyone in the state. The 2015 Act is a significant piece of reforming human rights legislation. Supports provided for and monitored by the Decision Support Service will ensure that people are afforded the fundamental human rights to make their own decisions as far as possible about their personal welfare, property and affairs and finances with degrees of assistance as needed for those who need them. This is why the operationalisation of a fit-for-purpose decision support service is one of the key strategic objectives of our strategy. Having worked personally over 40 years with vulnerable people and having personally struggled with various ethical issues around their support and independence, I, for one, am delighted to be here at such a time of change when we have a political system, government officials and other advocates who have driven through this reform. It is a major responsibility of the Commission to ensure that this will work, and I'm heartened by the steps the Chief Executive of the Mental Health Commission has put in place through an expert and committed director and a committed staff team to ensure that this works. Finally, I want to thank Minister Roderick O'Gorman and Minister of State Anne Rabbitte for bringing this Act to fruition along with their officials in the Department of Children, Equality, Disability, Integration and Youth. I've been waiting a long time to say that name of that department without stumbling, so I'm really pleased with myself. I want to thank them for their interactions with us as a Commission over the last few years in this regard. We look forward to working with them over the next few years to ensure that the theory becomes a practical reality as regards assisted decision-making for those who need it. I want to thank you all again for coming to support these two launches, and I look forward to working with everyone present in the future. Thanks again, Minister. We look forward to working with you and your officials, and thanks to the people from the HSE who are here also. Thanks to my colleagues in the Mental Health Commission who have put so much work into everything we're producing today and who work so hard and unseen through much of the year. We look forward to feedback on our strategy. Always throw that in. Feedback is good. Was it Maureen Potter used to say, if you have something good to say, please tell us, and if you have nothing good to say, save your breath to cool your porridge. Sorry, nobody here knows who Maureen Potter is, do they? Or was. Now I'm going to hand over to Orla Keane, the General Counsel and Secretary of the Board of the Mental Health Commission, to outline the key objectives of our new strategy. Thank you very much.